All right, let's now bring in health activist Dr Kgosi Letlape to talk to us about vaccine hesitancy and making vaccines mandatory. A very good afternoon to you, Dr Letlape. It's always a pleasure to see you. Thank you, as always, for availing yourself to SABC News.
Good afternoon to you and to the viewers.
Doctor, let's discuss the stark differences between vaccine hesitancy, which is obviously what we're talking about today, and anti-vaxxers. The former may have legitimate concerns about the vaccines, and perhaps it's important to discuss some of those concerns, which are perhaps the reason why so many people are still not getting the jab.
I think hesitancy is basically based on people getting conflicting messages and unrealistic expectations. And that can be dealt with by informing them, engaging them, and ensuring that we widen the network of people that are sources of credible information. And that's how we can deal with vaccine hesitancy and increase uptake.
Yeah.
We need to take the vaccines to the people and the vaccine information to the people, instead of waiting for them to come to the vaccines and the information.
When you talk about taking the vaccines to the people, I think that's the right place then to discuss what your views are on making vaccines mandatory. Do you think that this would help deal with the variants and assist the health system from this particular strain? But on the back of that, Doctor, I'd also like to discuss, the issue of mandatory vaccinations. It seems that the idea of, and I hate to use the word forcing, but that's really what people are saying at this point, that this is almost like forcing people to take their vaccine, that it's giving people who perhaps have conspiracy theories about the vaccines, or the anti-vaxxers, if you want to call it that way, it gives them sort of something more to go with, in terms of going with their narrative.
That's precisely the point. Vaccine mandates will be divisive in our society. I am pro-vaccines. I'm vaccinated myself, and I've had my second jab. And I think there's much, much more we can do to increase the uptake of vaccines. For example, every GP practice should be a vaccine site. We should be engaging with the traditional healers in terms of proper vaccine information, and none of those things have been done. So what we have done, we've saturated the privileged South Africa, where privileged South Africans live. But where ordinary South Africans live, there's still much, much more that can be done on a positive basis to increase the uptake of vaccines. We should also be offering boosters to everyone that is above 50. There's absolutely no reason why we should be keeping stock and be worried about the vaccine stocks not flying off the shelves. That's because we have not gone to where the people live. Yeah. Let's recruit every general practitioner to come in to be a site for vaccination. Let's recruit every independent nurse practitioner and other healthcare practitioners that within their scope of practice are able to help us with vaccines to be recruited to do this task. Let's ensure that society is encouraged. Family members are encouraged to say, make sure that everyone in your family is vaccinated so that you could have a safer family gathering for Christmas. We should be out there promoting the vaccines, increasing uptake instead of coming up with mandates. As a medical practitioner, I am not pro a police state or forcing people to vaccinate. You still have a right to refuse treatment if you have good reason. And our duty is to convince you, not to police you or to force you into taking a vaccine. There's much more that we can do. The other issue that we should take into account is the fact that we don't have sufficient vaccines to vaccinate everybody if we make it a mandate for everybody. We are not in the same position as first world countries that have more vaccines than the populations that they have. Our situation is not that rosy.
Doctor, you spoke about the involvement of GPs and saying that every GP should indeed have a vaccination site on their premises. And you also interestingly spoke about traditional healers, and I'm really interested to understand in what scope they would be participating when we're talking about COVID-19. I mean, initially when we were faced with this pandemic, I do remember that traditional healers were saying, look, we're being closed off from participating. And I really do wonder wonder in what way they would participate. I mean, if they would then be using Western medicine, then what exactly would be the point then? Then one might as well just go to, a doctor or a nurse or, the medical fraternity for help rather than going to traditional healers. So I'm very interested when you spoke about traditional healers. I'd really like to know in which way they would be assisting in all of this.
The traditional healers would be helped to educate about the benefit of prevention, the benefit of vaccination. Just like we use the traditional healers when we were having problems with HIV and AIDS.
Yeah.
They were not the ones that were prescribing the ARVs, but they were the ones that were educating people that with HIV and AIDS, there's a role for Western medicine. Please avail yourself to using antiretrovirals. We then ensured that provision of antiretrovirals was not a specialist doctor function. It was done by GPs. We then nurse-initiated antiretroviral therapy. That's how you take treatments to the people. So I'm not talking about the fact that the traditional healers should be the ones to vaccinate. But people go to traditional healers for their health. There are more traditional healers than doctors in our country, and they need to be utilized. But there's an important aspect of prevention, where all of us go and buy vitamins from Discam, things that come from Scandinavian countries that promote health. We should be promoting natural herbs that have been used for respiratory illnesses for a long time.
Yeah.
Lengana has been used. So we should not undermine our heritage and the usefulness of traditional medicines in terms of curbing these issues.
Yeah.
So they would promote vaccinations. They would also be able to promote the things that keep you healthy, just like we go and buy vitamin A, D, E, and K, and all the alphabets. There are natural herbs that deal with those issues. So we should not undermine our heritage or where we come from. And that's how we will get rid of vaccine hesitancy, and we'll have a different problem of not having enough vaccines to supply to our people.
Yeah, there is a thought, Doctor, that it is quite concerning, and I've certainly seen this sort of conversation going on, particularly on social media, where there is concern that even the vaccinated aren't safe from this particular variant. That's perhaps making it worse for those people who are vaccine hesitant, who are perhaps thinking, why must I vaccinate if there's no sort of guarantee for the different variants? And then there's also the question about, the boosters, continuing to take boosters for how long, and how many, and when will it, when does it end? And I think that's really part of the conversation that people are having.
We need to ensure that people have the right information, and have the right expectation. If you go back to normal flu, every season we vaccinate. Every season there are new variants for that season. So the issue in relation to viruses of repeat inoculations is not new, and it is driven by the science. When you get your vaccine, you get an immune response, and you have protection from the antibodies that are produced. With time, we know that the level of protection comes down, it wanes. And based on science, it needs to be boosted. We also know that the virus, for its own survival, keeps mutating. And science has shown that if all of us were vaccinated, we will reduce the mutations that would occur. And that's why it is important to promote vaccination and to vaccinate as many people as possible. Also, it has never been said to anyone that if you vaccinate, it's 100% proof. What has been clearly shown is that if you vaccinate, it protects against severe disease. We've seen from the first, second wave, and third wave that after the second wave, once healthcare practitioners were vaccinated with J&J, the number of admissions amongst healthcare professionals and the number of deaths drastically fell. They were greatly reduced.
Yeah.
So the vaccine protects you against severe disease, and it protects you against death. It does not mean if you're vaccinated, you might not contract the virus. That is why it is not an either or. The non-pharmaceutical methods remain critically important. Avoiding gatherings becomes critically important. Masking, ensuring that you wash your hands, you sanitize, all those issues together with vaccines is what's going to get us out of this mess.
All right. Dr. Letlape, thanks again for giving us your time. Much appreciated, sir. Until next time. Cheers.
Thank you.